Combat veterans are trained to survive by collapsing their entire existence into the body. In theater, survival demands raw somatic vigilance. It requires constant threat monitoring and an acute awareness of mortality. This isn't a flaw. It is a highly tuned, necessary adaptation. It keeps them alive.
But when they come home, that same collapse becomes the disease. The body stays at war. We often talk about PTSD as a disorder, a weakness, or a break in the mind. It isn't. PTSD is an adaptation that simply won't turn off. The alarm system is stuck in the on position.
The results of this stuck adaptation are devastating. On average, 17.6 veterans die by suicide every single day. The suicide rate for veterans is double that of the civilian population. Up to 23% of veterans who use VA services experience PTSD in their lifetime.
And our current solutions are struggling to keep up. Traditional trauma-focused therapies can take months or years to show results, and the process is grueling. Nearly 26% of veterans drop out of PTSD therapy before completion. For some exposure therapies, that dropout rate climbs as high as 68%. We are losing them because the treatment requires them to fight a war their bodies are already exhausted from fighting.
But there is a shift happening. A scientific intervention that changes the paradigm. Ketamine.
Ketamine isn't what most people think. It is not a simple sedative. It is not about numbing the pain or escaping reality. It is a controlled, therapeutic separation of the higher mind from the body's alarm system.
During combat, soldiers naturally dissociate. The higher-order mind, the part responsible for meaning-making, mission focus, and purpose, detaches from the raw bodily alarm. This allows them to function under mortal threat. This is adaptive dissociation.
Ketamine recreates that same dissociation, but in a safe, therapeutic context. It pharmacologically interrupts the pathological tether between the body's alarm signals and the mind's capacity for meaning, purpose, and continuity. This is not just symptom relief. It is applied hierarchy restoration, giving the full human architecture the room it needs to re-emerge.
The research backs this up with startling clarity. In a 2019 study by Ross and colleagues, 30 combat veterans received high-dose ketamine targeting a transpersonal dissociative experience. The results? A 44% reduction in PTSD symptoms and a 50% reduction in depression. The researchers concluded that the dissociation wasn't a side effect. It was the essential therapeutic feature.
And it happens fast. Randomized controlled trials by Fader in 2014 and 2021 demonstrated rapid reductions in hyperarousal, intrusion, and avoidance within 24 hours. This is a speed that traditional SSRIs simply cannot match.
At the neurobiological level, ketamine acts as an NMDA receptor antagonist. This triggers a glutamate surge and activates pathways like BDNF and mTOR, promoting rapid synaptic plasticity. It is literally rewiring the fear memory circuits in the brain.
So, what if we changed the model entirely? What if every veteran who served in a combat theater beyond a certain duration or intensity was automatically funneled into a structured decompression program?
Not a hospital. Not a sterile clinic. A retreat-style therapeutic transition. A deliberate, designed bridge between the war zone and civilian life.
This vision integrates ketamine-assisted sessions in controlled, supportive settings with comprehensive care. It includes psychotherapy and narrative therapy to rebuild authorship and meaning. It incorporates somatic work to teach the body that it is finally safe. It honors their service with unit-based legacy rituals, providing gradual, supported reintegration.
The goal is a paradigm shift, not just treating PTSD after it takes hold and destroys lives, but preventing the collapse by intercepting the transition itself.
The military trains soldiers to enter war with extraordinary precision. Why don't we train them to exit war with that same precision?
This vision isn't just a collection of treatments. It is built on a profound integrative synthesis, pioneered by the work of Daniel Anthony Weymouth, also known as Daniel Stars.
Weymouth identified a structural pattern across seemingly separate fields: combat psychology, terror management theory, neuropharmacology, and embodiment. He recognized that in war, survival collapses into the flesh. The body becomes the entire system.
In civilian life, that confinement becomes chronic. The higher layers of human experience, purpose, legacy, authorship, continuity, cannot re-emerge because the somatic alarm simply won't release.
Ketamine provides the pharmacological bridge. It temporarily severs that pathological tether, creating the necessary space for the full human hierarchy to diffuse outward again. This is not reductionist pharmacology. It is applied hierarchy restoration.
The brilliance of this approach lies in the lens itself. Synchronizing siloed information from separate domains into one coherent frame is the method. It is cross-domain structural synthesis, and it holds the key to true recovery.
The science is here. The mechanism is